Hello, my name is Lyle Murphy, and I am the founder of the Alternative to Med Center, a facility that helps people withdraw from psychiatric medication. In the 17 years that we have been doing this, we've seen some of the most extreme cases, not just of people having severe withdrawal manifestations, but at times damages from the drugs themselves. And one of the things that our readers wanted us to touch on was a phenomenon called Tardive Psychosis and Tardive Dyskinesia. So the first question is, what is Tardive Psychosis? Tardive Psychosis, the word tardive, like as in tardy, means late. So the word itself would mean a late psychosis. It's associated with psychosis that has developed as a byproduct of taking the antipsychotic. So it would be a new manifestation of new psychotic symptoms after having taken antipsychotics for a period of time. The mechanism behind this, as described by Haro and colleagues in a publication that was a 20-year-long outcome study that followed people who had been taking antipsychotic medications for a 20-year-long period. They had noticed that at a certain point, about 2 years after taking antipsychotics, that people actually had more psychotic symptoms, and they were more likely to end up back in the hospital as compared with their non-medicated cohorts with similar diagnosis. So the phenomenon behind this mechanism has been affectionately dubbed antipsychotic-induced dopamine receptor supersensitivity. So what that means is that because the medication was holding back dopamine, that the receptors themselves become more receptive to dopamine in order to try to counterbalance. So then when there's either a change in the medication, or even if the medication is held stable, it may just not be enough, and the body in its adaptation process tries to help with stimulation and results in people actually getting more psychotic as a result of being on the meds. Next question, what is tardive dyskinesia? Tardive dyskinesia is a byproduct of antipsychotic medications. It is more associated with the first generation antipsychotics, but the newer second generation antipsychotics have also been noticed to cause tardive dyskinesia. Next question, what does tardive dyskinesia look like? Typically, it affects the upper body the most. Facial movements, sticking out of the tongue, blinking of the eye, jerky movements of the head, sometimes of the arm, even sometimes of fingers and toes. But generally, they're motions that you cannot control, and they're repetitive type motions. What is the best treatment for tardive dyskinesia? Unfortunately, the treatments for tardive dyskinesia are not the most promising, but the first line is to withdraw the person off of the antipsychotic that they're on. Now, of course, that can pose challenges for people who are having psychotic symptoms to just suddenly take them off of their antipsychotic in a rapid way, because they could have an escalation in those symptoms. Even if long-term, they may be able to endure being off of antipsychotic medications, taking them off too suddenly could be somewhat cataclysmic. But another option is if they happen to be on a first-generation antipsychotic, such as Haldol, then they're switched to a second-generation antipsychotic. Oftentimes, they use either what's called benzotropine. It's also known as cogentin, to help soften the possibility of developing tardive symptoms from antipsychotics. And there is some evidence for suitable co-interventions to treat tardive dyskinesia that includes the use of VMAT inhibitors, including, I might butcher the names here because I've never used them here on folks, but deutrabenazine and valbenazine. That's what's in the literature. Now, as far as orthomolecular treatments, what we would use here might be 800 milligrams of vitamin E twice a day, vitamin B6 up to 200 milligrams in the morning, N-acetylcysteine, also known as NAC, at 1,000 milligrams or possibly even higher. Niacin in the form of nicotinamide, 1,000 milligrams twice a day. Melatonin, 10 to 20 milligrams at bedtime. And it's really because melatonin is an antioxidant. These folks do better with a strong antioxidant support. There is some good evidence behind manganese chelate, 10 milligrams of that twice a day. And know that any of these supplement recommendations that we're giving you, they really should be monitored by an orthomolecular practitioner. You can maybe look up the International Society of Orthomolecular Medicine and go to their database and try to find an orthomolecular practitioner that you can work with. And some of these interventions might be short-term. They might be something that you do at even higher doses than we're recommending, or that we've mentioned here rather, for a week, 2 weeks. And it does really need to be monitored. But another thing you could do is you could look up each one of these supplements that I mentioned, put in the supplement name, like for instance, niacin for treatment of tardive dyskinesia, or manganese chelate for treatment of tardive dyskinesia, and see what kind of information you come up with. There is a bit there, but you have to be a little more specific in your search terms. All right, next question. Is tardive dyskinesia life-threatening? Generally not. It is extremely disfiguring, but life-threatening, no. There have been cases where it's affected breathing, and that could obviously be a problem, but it usually does not result in any sort of fatal life-threatening scenario for the afflicted. Next question. Is tardive dyskinesia a severe side effect of antipsychotic medications? Yes. It's one of the many severe side effects of antipsychotic medications. There are others. There's neuromalignant syndromes, things that can come out of these medications. And in fact, in my opinion, these are the medications that should be very, very well thought out as to the cost-risk benefit. I find them to be more impactful to a person's long-term life than benzodiazepines, than opiates, than antidepressants, than any of the class of medications. Antipsychotics do quite a profound revamping of how your nervous system works, and there are a lot of side effects associated with these medications. And it pains me when I see them being used as first-line interventions on children that have other mechanisms for why they went psychotic. Either they took too many diet pills, or they were drinking, or something, normative for their age, and then they end up in a psychiatrist's office and are on antipsychotics, which can put them into a place in their life that they may not fully get out of. Can you get tardive dyskinesia without medication? I have never heard of that. I think it's only related to the use of antipsychotics. There are other type of syndromes like akathisia, like the word's slipping me right now, but other sort of movement disorders and Parkinsonian-like symptoms that can come from other mechanisms. But actually, tardive dyskinesia, I believe it's actually completely coined on the notion that it's from antipsychotics. What are the early warning signs of tardive dyskinesia? There's not a lot online about this, so I feel good in trying to answer this based on observation. So if a person's taking antipsychotics, there's a lot of different reactions that they can have, right? The antipsychotics are normally meant to bring you down out of the rafters and cause you to be sedated. So the normative effect is being oversedated, not having any reward, or lack of, not having a full access to your sense of reward, diminishing sexual function, making you sleep a lot, making you slump over in your body. Those are not side effects. Those are the effects of the medication. Now, if the medication is causing overstimulation, it's causing you to not be able to sit still, where you feel like you can't actually be in your body, or it's causing any sort of uncontrollable, or at least movements that you're not initiating, like you're having some sort of movements, especially in your head, neck, or jaw. These are definite warning signs. There's another phenomenon called akaesthesia, which is where you feel like you can't sit still in your own skin. If you're getting any of those type of symptoms, this is probably something you want to bring up with your prescriber and walk in with a big red sign saying, hey, I'm having this stuff happen. What's going on? Because being overstimulated from your antipsychotic is not the norm. It can happen sometimes with Abilify because Abilify is a little bit unique in the way that it binds to the receptor. It can actually increase the amount of dopamine in some of these symptoms. So Abilify can have this overstimulation thing happen as a byproduct of the drug. But usually those type of medications are given to somebody to help bring them down. So if you're getting overstimulated from your antipsychotic, that probably warrants a medication change. Let's see. How common is tardive dyskinesia? Well, in the early, the first line neuroleptics, what they call first generation, the thorazine, the Haldol, these type of medications have been around for a long time. I believe about some of them 60 years at this point. So there is quite a bit of evidence to pull from. And what they found was that about 20% of all patients who were treated with first generation neuroleptics had some degree of dyskinesia, whether it was a debilitating or just a minor version. That's 1/5. So considering this is one of the most, really almost grotesque sort of neurological impairments, that's a pretty high consequence and a pretty high patient population to consider whether the efficacy of these things is really warranted. However, the less studied second generations, it's a range from about 1% to 10%, and there's varying degrees of how debilitating or debilitated would qualify for having a tardive response to the medication. So they also found that women were at a higher risk, especially those who were middle-aged to senior women. For some reason, it affects their dopamine pathways a little bit more profoundly than in the male population, but males also are found to have this as well. And that will conclude the questions that we were going to answer regarding tardive dyskinesia and tardive psychosis. Really hope you appreciated this video. And feel free to like this page and to contact the facility if you need any more information. And have a good day, a good night, or a good weekend. Bye now.
Thank you for watching. Don't forget to subscribe to our channel. For information about Alternative to Med Center, give us a call at 888-984-9667.